We are very happy that we published in a GUT, it's a high impact factor journal, our results from a randomized sham control study comparing endoscopic pyloromyotomy, it means GPOM, versus sham procedure in patients with severe and refractory gastroparesis. Our study showed that treatment success defined as 50% improvement in symptoms was achieved in 70% of patients after GPOM compared to 21% after sham procedure. This difference was highly statistically significant, and this is the first study showing that the GPOM is really effective and can be beneficial for patients suffering from this debilitating disease. Moreover, we performed GPOM in those after the sham procedure without treatment success, so-called crossover GPOM, and the effect of this crossover GPOM was also 75%. So that is because gastroparesis is really severe disease with increased mortality and debilitating, and its treatment is a matter of discussion. It's really challenging because there are many treatment opportunities, but no one is really effective. I think that GPOM can really broaden the spectrum of treatments we can offer patients suffering from gastroparesis. I think this is the first study. Even we included only 41 patients, so we had to call this study pilot study. It's not a large study because it was in fact bicentric study. But we consider this study as a game-changing study. It means that this is really the first clear proof that GPOM works, and based on this study we can change our guidelines and practice all over the world. I do think there is a need for a large studies which would include 100 patients, for example, but according to me there is no need to have a control placebo group because we show that the effect of placebo is about 20%. So this is the significance, the overall significance of our study. It's true that for the Czech gastroenterologist it is not really a daily routine to publish in such a high impact factor journal such as GUT. And as I remember, the last study which was performed in the Czechoslovakia and was published in this journal was a study from Professor Mařatka, a legend, GI legend, in 1985. So that's why we are even more happy that usually that we succeeded and our paper was accepted in this journal.